thanks to the National Institute for Healthcare Management Foundation and Dr. Edwards and the American Academy of Pediatrics. We certainly borrowed liberally from the American Academy of Pediatrics information, including help from Fran Gallagher, who's the executive director here in New Jersey, as part of our pediatric advisory board to create our pediatric health home here in New Jersey that we kicked off in January of this year. So looking at where we've been on this about 4.5-year journey, and again, as Dr. Edwards very much focused around the triple aim, and really there's a quadruple aim. The fourth part of the aim is higher level of healthcare professional satisfaction, whether she be a physician or he be a nurse or an advanced practice nurse, medical assistant. So we very much look at that as part of our charge here at Horizon to improve healthcare affordability, and also create a more collaborative environment for managing healthcare effectively and affordable. We have within our patient-centered programs, our foundation program was the patient-centered medical home for adults. We've been ongoing with that for 4 years. And at the bottom of that list, and I'm joined by Eva Wasserman, who's going to take a few minutes to talk about our obstetrical episode of care program, which is near and dear to folks on this call as well, the beginning of life. And so we started with 5 practices in major joint replacement, and then we moved on into many other episodes, including obstetrics, which Eva will talk about. And then within those bookends, I think it might have advanced the slide a little prematurely. That's all right. We have the Comprehensive Primary Care Initiative, which is really a build on the adult patient-centered medical home. Dr. Edwards mentioned the Center for Medicare Medicaid Innovation. So we were fortunate here in New Jersey, along with 6 other regions, to receive the Comprehensive Primary Care Initiative, a 4-year program, which again harmonizes Medicare fee-for-service with ourselves and 3 other payers around the principles of person-centered, team-based, comprehensive care. The pediatric program we'll talk about in more depth, and then accountable care organizations are another important part of what we do. We now have 14 ACO partners, which is really a kind of a broadening or an extension of the principles of the medical home in a system of care. You can see on the next slide from our rather modest beginnings that if you moved over 1 year earlier in 2011, where we had 8 primary care practices and 5 orthopedic partners in our major joint replacement, 2012, a fairly modest footprint, 2013, taking us all the way now to this year, where the map of New Jersey and the major population areas are dotted with many patient-centered practices, adult, pediatric, ACO partners, and episode of care partners. And again, I'll let Eva talk in just a few minutes about what we're doing specifically in obstetrics around episode of care. Our guiding principles really are 5. Care planning and coordination, and we'll talk about that specifically as it relates to our pediatric program. And I would add another C there in addition to collaboration, which is our mantra here, and that's culture. Some of you may be familiar with a book that was introduced to me by Marcy Nielsen, the executive director of the Patient-Centered Primary Care Collaborative, the PCPCC, where I'll be speaking in a couple of days in their annual meeting, and that's culture. Kathy Sorensen and Kirk Kaufman talked about culture eats strategy for lunch, and it's absolutely vital that we take a culture here at Horizon which is collegial and collaborative, and we infuse that with our practices toward patient-centered care, toward team-based care, toward having individuals operate at the top of his or her certification, whether he be a medical assistant or she be a nurse or a physician or advanced practice nurse, and the back office part of medical practices as well. Data and technology, we place a lot of emphasis and attention on exchanging data with our practices. We'll talk about that as it relates to pediatrics, which right now is a bit of a lighter touch than what we're doing in adult medicine, but we still are exchanging some information with pediatric practices. Very important, obviously, engage, educate, empower patients, the notions of shared decision-making. We teach motivational interviewing, teach back principles. We have a lot of tools that we provide to our clinical partners on a medical home is not a nursing home or a mobile van, but is actually a place where you can expect to get comprehensive care, the right setting at the right time. We do a lot of education information, and it's not just a unidirectional in our program support that is in that oval where we have our playbook. A lot of our education is being done by our clinical partners. So when we do webinars monthly, it's not Horizon or outside experts from Minnesota or Colorado or Oklahoma or anywhere else, though we work with folks outside of New Jersey. It is our thought leaders talking about how they're dealing with low acuity, non-emergent, ambulatory sensitive ER visits, how they're inculcating team-based care, how they're working on building their medical neighborhood. And of course, as a payer, we focus a lot on payment reform, and I'll talk about that in more detail as it relates to our pediatric program. So again, we've talked about improving care coordination, delivering the right care, the right setting at the right time. That's very much a cornerstone, and I'll get into in a minute how we're reimbursing for care coordination and specifically around care planning for that minority of patients in a pediatric practice that are high risk or chronic. Talked a bit about patient engagement, the importance of data, and we're constantly evolving ourselves, working on our bidirectional data exchange with our practices, and payment transformation going from fee-for-service toward much more fee-for-value. In our pediatric model, we are paying for, at the number one position, you can see we're paying for care plan development, so that's an initial payment of $125 for the initial care plan for a person with autism spectrum disorder or type 1 diabetes or asthma or depression or whatever that situation might be for that young person, and then updates to their care plan we're paying for a maximum of twice a year. Horizon is providing support to our pediatric partners with trained RNs that are on my team that are dedicated to coaching and to improving practice workflows, workflow redesign. Certainly we have our thought leaders here in New Jersey, and again, we will go to Dr. Stoller or others and Dr. Schlitt to help them to help their colleagues. And the pediatric community here in New Jersey is highly collaborative, which we appreciate. We pay for quality, and so that quality is largely based on a set of measures that will be very familiar to the folks on this call, which I'll get on the next slide. And then we also have one efficiency measure, which is related to emergency department visits. In contrast, in our adult model, we're looking at generic dispensing, which is already really, really high in the pediatric program. We're looking at inpatient admissions per 1,000, which are already very low in the pediatric program. So it's hard to improve on things that are already quite good. And then we also look in our adult program at total cost of care is our fourth measure. So in pediatrics, we're using just one utilization metric, as you'll see on this next slide, ER visits per 1,000, where we think there's still an opportunity to see some improvement in that particular metric. On the quality side, weight assessment and counseling, nutrition, physical activity, children and adolescents, childhood immunization, appropriate testing for children with pharyngitis, appropriate treatment of upper respiratory infections, which partly ports over to a cost measure, but as we know, with antimicrobial resistance, very important not to overprescribe antibiotics. Development of screening tool used in the practice, child and adolescent access to primary care, ages 7 to 11, access for children, young adults, adolescents, 12 to 19, and adolescent immunization. So those are our quality measures that we benchmark from the Health Effectiveness Data Information Set, aka HEDIS, and this is how we define the utilization measure for ER visits per thousand, which looks at both how the practice is doing against itself and also how the overall network here in New Jersey is trending to achieve a outcomes-based payment for this efficiency measure. And I think that may be, is that my last slide, Eva?
I think so.
And now I'm going to turn it over to Eva just to give a very, very high-level overview about an exciting program that we launched just this year, our obstetrical episode of care program.
Thank you, Stephen. I'm Eva Wasserman. I'm a transformation coach on the episode of care team. It is very exciting. It's another way of extending that initiative to incent specialists to coordinate care. The specialists, we call them more of like the orchestrator. They're helping to attain that triple aim of reducing healthcare costs by taking a look at an episode like pregnancy and trying to avoid duplicative services that can arise. Also, hopefully improving the clinical outcomes, which is another aim, and in pregnancy looking at reducing, the goal would ultimately be to reduce C-section rates, and they can do that through patient engagement and education, and sometimes it's unavoidable, but usually there's some education that can go in there. And also, we share the savings with these specialists on the episodes. So the pregnancy episode begins with a pregnancy, obviously. It takes a look at the 36 weeks prior to the admit date for the delivery of the baby, and then also 8 weeks after the discharge date. And that would be considered the episode that they're trying to coordinate that care in. And so by doing these initiatives, we're hoping here at Horizon that obviously, we're engaging physicians, pediatricians, specialists, primary care physicians to really help coordinate the care, and we're incenting them by sharing the savings.